The pumping action of the heart maintains blood flow throughout the human body. Cardiac output is a measure of blood flow. It is the volume of blood ejected from the heart over a given time. Cardiac output is determined by multiplying heart rate by stroke volume. Cardiac output in the typical resting heart is about 5 liters per minute. Cardiac output is not constant. It varies with the body's metabolic demands. Mild exercise will double cardiac output, while an intense workout can increase output as much as 4-fold to 20 liters of blood each minute. Stroke volume is directly correlated with cardiac output. The greater the stroke volume, the greater the cardiac output. Stroke volume represents the difference in the amount of blood between the volume in the ventricles at the end of diastole and the volume after systole. Three factors increase stroke volume: increased preload, increased contractility, and decreased afterload. Preload is the degree of stretch of cardiac muscle cells prior to contraction. The amount of stretch is related to the end diastolic volume. Increased return blood flow from the veins increases end diastolic volume. Cardiac muscle sarcomeres stretch and lengthen. Contraction of the cardiac muscle sarcomeres during ventricular systole provides the force to eject blood from the heart. Sarcomere length affects muscle tension and the force of contraction. An increase in muscle stretch increases tension. A more forceful contraction ejects more blood, thus increasing stroke volume. The relationship between preload stretch and stroke volume is known as the Frank-Starling law of the heart. The greater the preload, the greater the sarcomere stretch, the greater the stroke volume. The Frank-Starling law has limits. When cardiac muscle is overstretched, increasing ventricular filling has no significant effect on stroke volume. Contractility is the forcefulness of cardiac muscle contraction. Inotropic agents can increase or decrease contractility at any given level of stretch. Positive inotropic agents increase contractility, thereby increasing stroke volume and cardiac output. Negative inotropic agents reduce force of contraction. Positive inotropic agents include neurotransmitters, hormones, and some drugs. Certain drugs, such as calcium channel blockers and some anesthetics, are negative inotropic agents and reduce contractility. Afterload is the pressure or force that the ventricles must overcome to push open the semilunar valves and eject blood. Blood pressure in the left ventricle must overcome arterial pressure in the aorta in order to open the aortic valve. Hypertension increases aortic pressure, and the left ventricle must work harder to generate the pressure required to maintain stroke volume and cardiac output. Eventually, ventricular pressure builds to overcome the elevated arterial blood pressure, and blood is ejected from the heart. As afterload increases, ejection is more difficult, and both stroke volume and cardiac output are diminished. The ventricles compensate for decreased cardiac output in two ways: by activating feedback mechanisms that increase preload, and by initiating hypertrophy in cardiac muscle cells to increase contractility. The sinoatrial node normally initiates 60 to 100 heartbeats per minute. A normal resting heart rate is about 75 beats per minute. Heart rate and cardiac output are directly proportional to one another. The greater the heart rate, the greater the cardiac output. Heart rate is influenced by such conditions as exercise, stress, blood loss, and tissue damage. More importantly, the autonomic nervous system and hormones play key roles in the regulation of heart rate. A decrease in blood pressure promotes sympathetic stimulation, the release of norepinephrine, and thus an increase in heart rate and cardiac output. An increase in blood pressure promotes parasympathetic stimulation, the release of acetylcholine, resulting in a decrease in heart rate and cardiac output. The hormones epinephrine and norepinephrine, secreted from the adrenal gland, as well as thyroxine, accelerate heart rate. Low blood oxygen and pH, as well as high blood carbon dioxide, also trigger an increased heart rate. Additionally, moderate increases in cytosolic levels of ionic calcium also increase heart rate.